Hi, I'm Natasha, a registered nurse and care management strategist. I help healthcare organizations implement technology supported care management models that improve patient outcomes while also increasing practice revenue. And I teach nurses how to build care management businesses aligned with how healthcare is actually being reimbursed today. Let's talk about something that needs to be said. Nurses are the missing link in primary care because when you look at the challenges in primary care today, you have overloaded providers, patients with multiple chronic conditions, limited time during visits. So the real question becomes who is managing everything in between? And the answer is most of the time, no one. Primary care is built around office visits, but patients don't live their lives in 15-minute appointments. They're managing their health every single day. They're taking medications, making decisions about their health, dealing with symptoms, trying to follow instructions they may not fully understand. And without consistent support, the plan of care breaks down, not because it was wrong, but because it wasn't supported. Let's slow this down for a second. Think about a patient with diabetes and hypertension. They leave the office with a plan. Take your medications, watch your diet, monitor your blood sugar. That sounds simple. But when they get home, what does that actually look like? They're trying to figure out what to eat. They're not sure when to take their medications. They may not understand what their blood sugar numbers mean, and no one is checking in. No one is guiding them through that process. So over time, their condition becomes uncontrolled. And then we say the patient is non-compliant. But if we're honest, they were never supported. And this is where nurses step in. One of the most powerful roles nurses play is education, not just giving information, but making sure patients actually understand what to do, breaking things down in plain language, reinforcing instructions over time, answering questions patients didn't ask during the visit, because education is not a one time conversation, it's a process, and nurses are trained to guide that process. Nurses also play a critical role in monitoring chronic conditions. We don't just document what's happening, we recognize patterns. We notice when something is off. We ask the right questions and we intervene early, whether it's blood sugar trends, blood pressure changes, worsening symptoms. Nurses are trained to assess and respond. That's what prevents complications. And this leads to something even more important: early risk identification. Because most hospitalizations don't happen suddenly, there are warning signs, subtle changes, missed medications, increasing symptoms, barriers that were never addressed. Nurses are often the first to see those changes. And when we're involved consistently, we can act before things escalate, before that patient ends up in the emergency room. Now let's look at this from the provider side. Primary care providers are carrying a heavy load, large patient panels, limited time, high expectations. They are doing what they can within the visit, but they cannot manage everything alone, and they're not supposed to. Nurses extend that care beyond the visit. We help manage the chronic patient population. We help keep patients stable. We help reduce unnecessary visits and this is not about replacing the provider. It's about strengthening the care team. So care doesn't stop when the visit ends. The care plan is the foundation of nursing practice. It's how we organize care, it's how we think, and it's how we ensure that every patient has a structured, individualized approach to managing their health. In care management, that plan doesn't just sit in a chart, it's active, it's updated consistently, and it reflects what's actually happening with the patient. Nurse care managers work closely with patients to carry that plan forward over time. So when we talk about the gaps in primary care, education gaps, follow up gaps, coordination gaps. Nurses are not just part of the solution. We are the link that connects everything. This is about recognizing the role nurses already play and structuring it in a way that improves outcomes across the board. because when nurses are fully integrated into primary care, everything works better. Patients are more supported, conditions are better managed, providers are better supported, outcomes improve, and that's where healthcare is going. If you're a nurse and you want to learn how to step into this role or build a business around care management, I break this down inside my online school, Empower Care Academy. I'll leave the link below so you can join us. And if you're a provider looking to improve patient outcomes while also building a more sustainable model, integrating nurses into care management is one of the most effective things you can do. Make sure you like this video, subscribe to the channel, and I'll see you in the next one.